Yeah, after the surgery, she would have to have a 5-day hospital stay. And so we had kind of planned out. So by this point, we have little brother, Jude, in the picture. And so we had really talked about it and prayed about it. Of course, he wanted to be there too. We both wanted to be in the hospital with her every day. But this was kind of something I was actually, you can take a little pause in the story, I was going to ask you, when it comes to a child that has pretty significant health things going on, and you have this other kid, which Jude's just an amazing little guy and handled it super well. But we had felt peace about Michael staying with him and just coming to visit here and there, which is hard because you split up your team then. And so just advice or, even a question of like, what is the best way to handle that when it comes to siblings and you start seeing emotions in them? And, I'm sure families have faced some of that too.
Yeah, it's a very real thing. I think y'all were super wise, and I don't think there's one right way to handle it, or to handle it different than you did would be wrong. But I know for me, we had a similar thing when our daughter was born, but we were in another country, so we had no family, anybody to help. And so we were this is before our second was born, but saying I'm going to be in the hospital from August until she's due in October. And we have a 2-year-old at home and no support system. And it's like, I can't be in the hospital for 3 months. That's crazy. I have a 2-year-old. But I think the Lord just gives wisdom and help. And we kind of did the same thing. It's like, okay, I'm going to have to focus on the baby. You're going to focus on the 3-year-old, and it's, and you trust the Lord with it. So I think y'all were super wise.